So we're going to talk about the brain and cranial nerves first, which is chapter 16, prior to getting to chapter 14, which is the spinal cord and reflexes. And part of the reason for this is the brain is more complicated and a little more difficult and challenging to kind of master. And I like to give you guys more time with the brain. Spinal cord is a lot simpler and easier to understand. So we'll go through that first. Okay, a couple of things that I really want to stress is that it is always going to be sensory in, and it's always going to be motor out. And that is into the central nervous system, out of the central nervous system. So central nervous system. So sensory and motor out. Sensory is always going to begin at sensory receptors, and they could be external, internal. A lot of different sensory receptors. Some of them are general senses, special senses, so forth. But they all start at receptors. And then the sensory in is the afferent division. Now, we went through this in chapter 13. So hopefully you remember some of these terms. It's afferent division going in, and out is the efferent division. And the efferent division could be somatic or autonomic. Somatic refers to skeletal muscles, and autonomic is going to refer to cardiac, smooth muscles or glands that secrete things. All of these things are termed effectors. So that is the name of skeletal muscles, smooth muscle, cardiac muscle, and glands. They're effectors. So again, looking at this diagram, super important to understand just the basic overview of the nervous system. So know and understand this, right? You have the central nervous system, which is the brain and spinal cord. It's the integrative and control center, and it is exchanging information with the peripheral nervous system. So sensory is coming in and motor is going out. Sensory is the afferent division. Motor is the efferent division. And this basically arises from here. Sensory in and motor out. Now, the motor is further subdivided into somatic nervous system, which is skeletal muscles, voluntary control over skeletal muscles, so somatic. Autonomic is going to be visceral. It's going to be cardiac and smooth muscle and glands. And it's divided into parasympathetic, which is rest and digest, or sympathetic, which is fight or flight. So understand that. The brain, very complex, and we still don't know a lot about the brain. People, I don't know, they have issues with having their brain studied while they're still using them. So it's a work in progress. Billions of neurons. Most of the neurons in your body or neural tissue is in the brain. We'll talk about nuclei and centers. That we went over this kind of in chapter 13. And there are 6 major structures of the brain. We'll go through that. By the way, sulci are furrows or shallow indentations, and gyri are ridges. So in the cerebral cortex, when there are these cortical folding, well, it actually looks I'm not even drawing it very well, but I'll show you. Anyways, it's so you can have increased surface area in the cerebral cortex. As far as development, the brain begins as a neural tube, and then during development, we'll differentiate into really a forebrain, a midbrain, and a hindbrain. So this is the fore, mid, and hind. And it kind of makes its way into, this becomes the brainstem, and this is midbrain. And this really is the higher functioning brain. All animals have some semblance of this, but more developed animals have this. Less developed animals, yeah, they have a cerebellum and pons and medulla oblongata, possibly a midbrain, but the less developed, the less cerebrum and diencephalon. So let's talk about that. The cerebrum is this cortical folding. So again, the sulci are these depressions in here where it folds, the neural tissue folds in, and then the gyri are these like areas where it's rounded up. So it's basically folding in on itself. So it has more surface area for more neuron cell bodies. And that's what these gyres and sulci are. The cerebrum is really where everything that you think and feel and contemplate and all your perceptions, which are basically a conscious awareness of the sensory information that is coming in to your brain. Again, we have all these sensory receptors. They are sending action potentials or sensory information into your central nervous system, your brain. Some of these you're aware of, others you aren't. When you are aware of the sensory information coming in, we call it a perception. You have things that come in all the time that you're not perceiving. So that would be an unconscious sensory information. But all of this is really in your cerebrum, your personality, your everything about you. A little bit lower is your diencephalon, and this is where you have subconscious things going on. Your thalamus, you have two thalamic nuclei, so two, one in each hemisphere. So two thalamic nuclei and then one hypothalamus. This is your diencephalon, and so thalamus and then hypo below thalamus. We'll talk a little bit more in detail, but your thalamus is this area where there are all these cell bodies, and all sensory information is really synapsing in the thalamus on the last or third sensory neuron that goes to a cortex area. And so what happens is you have the peripheral nervous system where there's a sensory receptor. And that sensory receptor is going to get excited. Right, so here's the receptor, goes in and it synapses on, so that's number one, synapses on another neuron that's located in the spinal cord. In the spinal cord. And so this is number two. And then this goes up and synapses on a third one, and this is located in the thalamus. And then that goes to the cortex, whatever cortex. So that is to say, everything synapses in the thalamus. It's a relay and processing center for sensory information. So that's why it has that, because we have this synapse in the thalamus of all sensory information coming in. Hypothalamus, part endocrine, part nervous system, got a lot of things going on. So we're going to talk about that in the lecture a little bit later. And then we're going to revisit that in chapter 19 when we talk about the endocrine system. Then we have the mesencephalon or midbrain, which is this area here, and we have some visual, auditory, reflexive nuclei. We have reflexes somatic motor response, meaning we have some basic reflexive motor patterns stored there. And we also have the reticular formation, which is maintaining our consciousness. A little bit lower, we have the pons, kind of sticks out. It's directly across from the cerebellum. And so it synapses and relays information to the cerebellum and then up to the thalamus from sensory information, proprioceptors. And you also have subconscious somatic and visceral motor centers. You have your respiratory centers that are located in the pons for breathing, rate, and depth. The medulla oblongata is a brainstem continuous with the spinal cord, right? And you have basic reflexive autonomic nervous centers for cardiovascular, so your heart contracting, and respiratory for breathing, and digestive. So, you know, when someone kind of is considered brain dead, that basically means that the only thing functioning is the medulla oblongata, and everything else has ceased to show any neuronal activity. So yes, they can still be breathing and have a heartbeat, but the term brain dead generally refers to nothing above the medulla oblongata showing any neuronal or nervous tissue activity. And then there's the cerebellum. This is what we call our motor brain here in the back. This is where we actually monitor muscle tone and kind of our movements minute to minute. It's kind of taking in that proprioceptors from our muscle spindles, telling us about muscle length, and Golgi tendon apparati that are located in the tendons that send information to the cerebellum about the tendon tension and joint angle receptors. And it's constantly sending it to the cerebellum, and the cerebellum then can adjust and send it to the what is called the primary motor cortex right here. Primary motor cortex, and we'll talk about that, which will then send out signals to our skeletal muscles. So that adjusts somatic motor centers. So cerebrum. So there are two cerebral hemispheres. There's a right and a left, and they're separated by a long kind of fissure or indentation called the longitudinal fissure. And the cerebral cortex is that outer layer that has the sulci and gyri. This is where really the majority of the cell bodies of the neurons are located in the cerebral cortex. Diencephalon has the epithalamus, which is on top of the thalamus, and it contains the pineal gland. It's an endocrine gland that secretes melatonin. And we'll talk about melatonin, chapter 19. Also, the epithalamic area on top, you have the choroid plexus. So we'll talk about the choroid plexus as well. Then you have the two thalamic nuclei. And so you do have two choroid plexes because you have two thalamic nuclei, but one pineal gland and one hypothalamus. So again, the thalamus relays information, all sensory information is going to synapse on a neuron in the thalamus and then go to its specific cortex. And we'll talk about cortexes. The hypothalamus, which sits below, is involved in a number of things, including endocrine, producing a couple of hormones, producing regulatory hormones over the pituitary gland, which it connects to, in addition to having autonomic nervous centers for heart rate, blood pressure, thermal regulation for temperature, circadian rhythms for sleep-night cycle, satiety, whether you're hungry or thirsty centers. So there's a lot going on in the hypothalamus. Then we have below that the mesencephalon or midbrain, again, auditory, visual, reflexes, the reticular formation for maintaining consciousness and alertness, and some reflexive somatic. Pons relays information to the cerebellum and then up to the thalamus, and as part of kind of your motor system, as well as the cerebellum, which is coordinating your motor functions. And then again, the medulla oblongata has very basic regulatory functions. So you do need to know the 6 major divisions, and you need to know what each one does, right? So the basics. So let's talk about the blood-brain barrier. The neurons in your central nervous system do not have direct contact with your blood. There's something called the blood-brain barrier, and water-soluble materials cannot pass through the cells, only lipid soluble. And so certain things can get through this blood-brain barrier and other things are regulated, very highly regulated. And the cells that are responsible for this are the ependymal cells in the choroid plexus. So the choroid plexus are these ependymal cells that regulate the production of cerebral spinal fluid, or CSF. And these cells work, the cells in the choroid plexus work with the cerebral capillaries to produce cerebral spinal fluid. And then the cerebral spinal fluid actually dumps into the venous blood that returns back to the same area actually that the arterial venous blood dumps into, these dural sinuses. So the cerebral spinal fluid that's created by the choroid plexus, the ependymal cells, flows through these spaces called ventricles. So ventricles are fluid-filled cavities within the brain. They are filled with cerebral spinal fluid and lined with these ependymal cells. The cerebral spinal fluid is what provides nourishment, gases, and whatever the neurons are going to need, ions, so forth. And so the cerebral spinal fluid is really what makes contact with these neurons, and the cerebral spinal fluid circulates through the ventricles as well as down through the central canal and then around the outside of the brain in the what is called subarachnoid space. So we're going to talk about the meninges after this. The meninges surround the brain, and that is on the outside of the brain where the cerebral spinal fluid is located. On the inside of the brain, it's located in the ventricles. So you have 2 lateral ventricles, and there's one in the right hemisphere and one in the left hemisphere. And so we can just call one is right and 2 is left. And each one goes throughout the whole hemisphere. So it goes to the frontal lobe, all the way back to the parietal lobe, to the occipital lobe, and around to the temporal lobe. And then these lateral ventricles have little holes in which they drain the cerebral spinal fluid into the 3rd ventricle. Now the 3rd ventricle is between the 2 thalamic nuclei. So you have 2 thalamuses with the thalamic nuclei, and there's a space in between those 2 nuclei, and that is called the 3rd ventricle. The 3rd ventricle then drains through what is called right here, the aqueductive midbrain, to the 4th ventricle, which is here between the pons and the cerebellum. So when you look at it in a frontal section, you're going to see the lateral ventricles. There is a thin membrane that separates those 2 lateral ventricles called the septum peduncle. You have the little foramens here that allow the spinal fluid to drain. Those are the septum peduncle. And then this right here is the 3rd ventricle between the 2 thalamic nuclei, aqueductive midbrain, and then the 4th ventricle. Then it starts draining. Spinal cord has a central canal. So this is how the central nervous system transports this cerebral spinal fluid. So again, this goes through the lateral ventricles in more detail. It gives you bullet points for you to study. I'm not going to reread these to you. But if you want to go through it slower, you have your list in your PowerPoint. Again, the choroid plexus. So this is showing you here how the choroid plexus is on top of the thalamic nuclei. And it's showing you more in depth that the choroid plexus are these specialized ependymal cells that are working with the cerebral capillary to really regulate the cerebral spinal fluid and what goes into it, and then what leaves it, right? So this is leaving, and this is coming. And then these ependymal cells can exchange with the neurons. And so this is all cerebral spinal fluid in here, in these ventricles. So this is kind of showing you it would be the third ventricle, right? So this space is the third ventricle. Now, cerebral spinal fluid is continuously being created and continuously dumping in to the venous system. And then from the venous system, it drains back to the heart, right? So it's getting created from cerebral capillaries, blood flow, and then it circulates around the brain for about 8 hours, gets dumped into the venous system. And so 3 times a day, you're creating all new cerebral spinal fluid. And so this is, it's a very serious ongoing process. Your nervous system really does utilize a lot of the energy that you need just in your basal metabolic rate. So this kind of shows you the flow of cerebral spinal fluid. So one is it's getting created by the choroid plexus. And you can see there's 1 and then 2 thalamic nuclei. And then it's flowing from that third ventricle. So this is the third ventricle in between. And here would be the laterals. Right, so it's kind of showing you one lateral, but not the other. And it's flowing really through the aqueductive midbrain to the fourth ventricle. And then it can leave here, this median aperture is a hole where it can leave and go into the subarachnoid space. So right here, subarachnoid space, which is part of the meninges, and we'll talk about that. It's this kind of middle layer of the meninges. And then in that subarachnoid space, the cerebral spinal fluid kind of flows all around the outside of the brain, right? It can go that way and that way. The lateral aperture also allows cerebral spinal fluid to circulate. Or it can go down the central canal. And then around the spinal cord, there's also the subarachnoid space, which cerebral spinal fluid flows. It eventually comes back up and it will drain into this right here. This is the dural sinuses. We'll talk about this again when we talk about circulatory system, which contains venous blood going back to heart. And so this venous blood going back to heart is in the dural sinuses. And through these arachnoid villi, or your book calls them granulations, arachnoid granulations, cerebral spinal fluid can enter. So cerebral spinal fluid here can enter the dural sinuses and join, right, and join the venous blood flow that will then go jugular veins and vertebral veins back to the heart. This cerebral spinal fluid, in addition to supporting the neurons, it also kind of floats the brain a little and creates a little bit of a cushion between the neural tissue and your really tough meninges, the outer layer of the dura mater, and your cranium. So it gives you a little bit of a floating brain. And so it kind of acts as a little bit of a cushion. Certain medications or drugs like ecstasy or Molly, they can interfere with the production of cerebral spinal fluid, and so you end up with a little bit lower cerebral spinal fluid, which gives you a headache. So that can happen. If you have a spinal tap, they're checking you for meningitis. They have to pull out some cerebral spinal fluid to check for an infection in the cerebral spinal fluid, which is what meningitis is. It's an infection or inflammation in the cerebral spinal fluid, which is located in your meninges. If they stick a needle through the meninges and there's a little bit of fluid leaking out before that dura mater can heal, people often get headaches. So again, anytime you have a tiny lowering of the cerebral spinal fluid, it can make your neurons kind of less floated, or your brain less floated by the cerebral spinal fluid, and that could have it touching or putting pressure in it, and you feel pain. So go over the circulation of cerebral spinal fluid, and this kind of goes through this again. Again, most flows into the subarachnoid space via the arachnoid granulations, and that's what your book refers to it as. So that's kind of a recap there for you. So meninges, I have referred to the meninges, and we'll go over them. Doesn't this look like Shrek? I think it looks like Shrek, those little ears. Shrek. So you have the scalp, which is your skin, and then you have the epicranial aponeurosis between your frontalis muscle and your occipitalis muscle. Then you have the periosteum that's covering your cranial bones, and then from there becomes the meningeal layer. So the first or outermost layer of the meninges is this tough fibrous layer called the dura mater. Then deep to the dura mater, you have the arachnoid mater. Sorry, that's 1, and then that's 2, and then 3 is the subarachnoid space, which is below the arachnoid mater. And then you have the pia mater, which is really covering the cerebral cortex, is the pia mater. So that's the deepest. So that's 4. So cranial meninges, you have, again, cerebral spinal fluid. So you have cerebral spinal fluid in here, and you have the dura mater. And then below it, you have the arachnoid mater, right? And the arachnoid, because it kind of looks like spider webs. And then you have the subarachnoid space where you have cerebral spinal fluid. And then last, you're going to have the pia mater here, which is kind of covering the cerebral cortex. And so this cerebral spinal fluid can go into what is called the dural sinuses, which is venous blood, right? And so this is how the cerebral spinal fluid goes back. Now, the dural sinuses have all this venous blood that is going to then go back to your heart, to your jugular veins and vertebral veins. And right below the dura mater is this subdural space. And the subdural space is important. It kind of separates a little bit between the dura mater and the arachnoid mater. And when anyone has a subdural bleed, they hit their head, they breach somehow this membrane, this dural membrane, and blood that's in the venous, these dural sinuses, can start kind of dripping into this subdural space and then go in towards the subarachnoid space. And when someone has a subdural bleed, it can take a couple of days for this venous blood to just slowly get into the subdural area enough to start putting too much pressure on the neurons, and that could actually lead to someone dying. So when someone hits their head really hard with no helmet, it really requires a CAT scan or MRI to see if someone has a subdural bleed. There's no way to check unless they have some kind of scan. And so that's why, we have this kind of hypersensitivity to someone hitting their head really hard without a helmet. They can have concussion symptoms, but they can also have a subdural bleed. And that's when, if you're never sure, go get that checked out. Epidural, like if someone has an epidural in their back for pain relief, they're going to administer the anesthesia on top of the dura, epi being on top. And so you're not actually breaking through the meninges. You're just trying to anesthetize the spinal nerves. So again, 3 layers of the cranial meninges from outside to inside. And I can't write when I'm thinking. Inside is dura, then arachnoid, then pia mater. Again, this just kind of reviews protection and cranial meninges. When someone has meningitis, again, they have an infection. If it's viral meningitis, it's an infection of the cerebral spinal fluid. So meningitis is an infection of the cerebral spinal fluid. It could be viral, which is self-limiting. So you just do comfort care. It really hurts. Your head hurts. Your neck hurts. The meninges cover your spinal nerves, the beginning of your spinal nerves, and your cranial nerves, like your optic nerves. So your eyes hurt. But it is self-limiting. So you hurt for a while, right? You get nauseous. You have all these neurological symptoms. Bacterial meningitis, that's the one you usually get vaccinated for before you move into a dorm at college. Bacterial meningitis really can kill you, and it is not self-limiting. So if you do not get antibiotics and treated for bacterial meningitis quickly, it could be a major issue and life and death. People lose their limbs. It's not a great thing. So viral, okay, bacterial, not okay. How do you know the difference? Got to go in and get a spinal tap, and they have to pull out some cerebral spinal fluid and actually check. How do I know this? I actually had viral meningitis. It does hurt. It took, God, 2 months to get over. It's not fun. Okay, so white matter tracts. There are different kinds. There's commissure tracts. Commissure tracts basically let one hemisphere kind of one hemisphere talk to another hemisphere. So they're between right hemisphere, left hemisphere. Those are commissure, like the corpus callosum or the anterior commissure fibers. Then you have association fibers, and they're associating within the same hemisphere, right? So association within the same hemisphere, just between gyri and sulci of neighboring gyri and sulci. And then you have projection fibers, and those project from, say, the cerebral cortex down to the pons, or cerebral cortex down to the midbrain. They project to another area of the brain, and so those are projection fibers. All right, let's go over these 6 areas of the brain, and then we'll finish up with cranial nerves. So the cerebrum. Cerebrum is the highest order of function. The cerebral cortex really does any kind of function that you can think of, and it is both involved in conscious and unconscious information processing, personality, thinking, formulating, reasoning, thinking about consequences, learning and remembering, emotion. So there's all kinds of stuff going on in this, your personality, in the cerebrum. And the cerebrum has different lobes, right? So we know that you guys probably know you have a frontal lobes on both sides, and parietal lobes on both sides, and occipital lobes on both sides, and then temporal lobes on both sides. Right? So everything, even your skeletal muscles are controlled by your cerebrum. So in the frontal lobe. So everything that's going on really is controlled by the cerebrum. That is why it's your higher order functions. So the cerebral cortex has integrative centers. And so they integrate all the sensory information coming in. They integrate all the motor responses that are leaving. They have specialized language areas. So Wernicke's is really where you can read language and understand it. You can hear language and understand it. You can use sign language and understand it. It's using your sensory input to understand language. Broca's in the front. That's how you form speech. It's your area of the brain that is controlling the muscles that produce speech. And then you have your receptive speech centers based on auditory feedback. Other things in the prefrontal cortex, this prefrontal cortex area, this is the last to be developed. So, you know, first to develop is really the brainstem, the stem, and then it moves up, mesencephalon, and then the diencephalon, then the cerebrum, and it really goes from the back, and then the last is the prefrontal cortex, and that is finishing development around 25. So prefrontal cortex, really the last to develop. And the very, very last to develop, this prefrontal cortex, is really the higher functioning reasoning skills, cause and effect, your highest level of thinking, really. And so this is the last to be developed later in life. And that is why, you know, 15 and 16-year-olds, you can't really ask them, why did you do something? Especially if it was a not well thought out thing. And you look at them and go, why did you do that? And they would look at you and say, I don't know. And there's a good likelihood that they don't know because they didn't have a functioning prefrontal cortex, and therefore it was not a lot of risk analysis going on. And they didn't really think about it too much before they did it. It just seemed okay. And so that's why people, as they get older, really start to contemplate and debate and think more about what they're doing, because their prefrontal cortex, they actually have the ability to do that, whereas you don't necessarily have the ability to do that at 15. You should have the ability, though, to do it by 25, 26. All right, gyri and sulci, elevated ridges, shallow depressions. Fissure, you have a couple of fissure, but the main one is the longitudinal fissure. These gyri and sulci, this folding helps increase the surface area, so you have more gray matter or increased numbers of neuron cell bodies, or neurons, I should just say neurons. Now the right hemisphere of the brain controls the left side and vice versa. So when we look at this, please understand that if you're controlling your right hand, the motor command is coming from the left brain to make the right hand do what it wants. If you're getting sensory information on the right side, so say you're feeling something here, you're going to interpret it on the left side. So there is this crossover. Your right hemisphere controls your left motor and receives sensory from the left side of your body. The left side of your body is really sending sensory information to the right hemisphere and vice versa. There is hemispheric specialization. The left hemisphere does have some speech and language and mathematics, so more task-oriented centers, and then the right hemisphere has more spatial centers. It's not exact, and so this is our best guess for today, that we have these specializations. So I don't want to get too much into that, but we'll keep going. So anatomy, you have what is called a central sulcus. And the central sulcus is a sulcus that goes all the way from the longitudinal fissure down to the lateral sulcus, okay? And that is the central sulcus. And that is important because it does a couple of things. It is the boundary between the parietal lobe and the frontal lobe, right? And this is the temporal lobe, and this is the occipital lobe. Then the gyrus directly in front of the central sulcus is called the precentral gyrus. So the precentral gyrus is this gyrus right here in front. And this is significant because the precentral gyrus is called the primary motor cortex. This is where the somatic neurons, these are also called motor neurons, that directly go to your muscle fibers. Well, not directly. There's another motor neuron. There's two motor neurons. But eventually, That's where the motor neuron that then synapses on the motor neuron that then goes to your muscle fiber. That's where it originates. And these are controlling your skeletal muscles, right? These are voluntary movements. Somatic is skeletal muscle. And so it is originating from the precentral gyrus, or the primary motor cortex. So I always like to say motor in front and then sensory in the back. And this goes for brain and spinal cord. Okay, so because the postcentral gyrus is the primary sensory cortex here, and this is where sensory, all general sensory information goes from the thalamus to the postcentral gyrus, to the somatosensory cortex, and then to an association area. So remember I said it goes from the sensory receptor into the spinal cord, synapse on a second sensory neuron, up to the thalamus, synapses on a third sensory neuron that then goes to the postcentral gyrus, which is the primary sensory cortex. So this is neurons receiving general sensory information, somatosensory, general sensory information from the thalamus. Now the cerebral lobes have cortex that are specific. So the frontal lobe has the primary motor cortex, conscious control of skeletal muscles. Parietal lobe has the primary sensory cortex, conscious perception of general senses. Occipital lobe has the visual cortex. So from the thalamus, if it was visual sensory input, it's going to go back to the visual cortex. Temporal lobe has the auditory and olfactory cortex. And then all lobes can integrate and process, right? And we have these association areas where you can associate sensory information coming from your visual cortex with sensory information about touch and whether it's painful or it feels good, and sensory information coming in about what you hear. Is it growling at you before it bites you, or is it wagging its tail and you know, making happy barks? I mean, we program this stuff into these association areas, bringing together different sensory inputs from different cortexes into one area to then form an association. So we don't have to keep making the same mistakes, right? This is what we call learning. And so going through these again real quick: precentral gyrus, these are your somatic motor neurons. This is where they originate here. There's a premotor cortex in front of it, and so it is motor in front, and meaning in front of the central sulcus. The postcentral gyrus, sensory in the back of the central sulcus. This, by the way, is all sensory. This is where all sensory information is coming in and getting integrated, right? So neurons are receiving sensory information for all general senses like touch, pain, pressure, and then vibrations and temperature, and also getting associations with visual cortex, auditory cortex, olfactory, which is smell, and gustatory, which is taste. So this goes through there, right? So olfactory is smell, gustatory is in the insula lobe, right above the insula lobe, and kind of inside, not on the cortex. Gustatory is taste. So association areas where all of these cortex then send information to get associated with one another. These sensory kind of inputs get associated with one another. Somatosensory allows for us to understand, you know, size, form, texture, how it feels, how it touches, if it's hot, if it's cold, that kind of thing. And then premotor uses memories of learned movements, right? So we have programmed things like driving, riding a bike, things that are pre-programmed in this premotor cortex to then immediately go to the primary motor cortex and then out to your muscles, right? So those motor units get fired or activated. Visual association areas, obviously, for recognizing things that we've seen before, and then auditory for recognizing sounds we've heard before. These association areas are helping us to coordinate our responses, right? And so it's like programming a computer. All sensory information that's coming in is programming your brain. So babies start out these blank slates um, of brain, and the sensory input that happens from the moment they're born is just inputting sensory data into their sensory cortexes and association areas. And so by the time you're older, you have this vast input of sensory input, and so you actually have a lot of knowledge about what things are, what things look like that are dangerous, that are not dangerous, and you don't have to relearn things every time, right? You have association areas that kind of remember for you. So again, kind of understand these association areas. Prefrontal cortex, working memory, executive task management, recall, solving complex problems, last to be developed. So a lot of times people, when they get to be 25, 26 years old, you know, they have an easier time solving complex problems. They have an easier time with working memory and paying attention because their brain really is finishing up development. This slide here is talking about the homunculus, and what this is just a representation of the number of neurons dedicated to that body part. So really a representation of number of neurons to that area body on both sides, right? So this is sensory input, right? And so we have a lot of sensory receptors in our hands, in our face, and in our mouth and digestive tract. We're oral, tactile, meaning touch, humans, right? Babies love to have their hand or something in their mouth, and they like to be touching things. And because they have a lot of receptors, and so they're just programmed to have as much sensory input as possible, right? That's why people like to chew gum, or they like to do something with their mouth or hands, spin a pencil on their hands, all kinds of stuff. And then we also have small motor units, meaning a lot of motor neurons going to our hands, because we have small motor units in our hands and in our face. We have a lot of control over these areas. And so there are a lot of neurons going to those muscles on the motor side. You don't really have to remember anything about the basal nuclei other than it is included with the cerebellum as part of your motor system. There are these masses of gray matter kind of embedded on the lateral sides that consist of these, you know, the caudate nucleus, a little bit of the amygdala, the claustrum, the putamen, and the globus pallidus. You don't need to know any of that other than the basal nuclei really is controlling and integrating, helping to control and integrate skeletal muscle tones. It works with the cerebellum, the thalamus, and sending things to the premotor cortex and primary motor cortex. That's all I'm going to say about it, right? But you can see it's adjustment of motor in different areas. Again, you don't have to spend too much time memorizing any of that. I just wanted to touch on it. All right, so this for lab. I'm not going to have any diagrams on my exam, but I'm going to help you guys kind of go over. This is one hemisphere, right hemisphere. It's a mid-sagittal section. And I want you to take a look at this diagram real quick, because I want to see if you see something. And I mean see as in sea creature. Do you see a sea creature in this diagram? I always like to think it's like this could be kelp, a kelp forest. That could be kelp, it could be, I don't know. Anyways, kelp. So it's in the sea. Do you guys see the seahorse? It's kind of a hipster seahorse. It has a little goatee and a little man bun, right? Because that's his mane. And it goes to school. It has a backpack on. Right, and here's coral reef. Anyways, I got my seahorse. It's to help you guys remember. So let's go through this. So this is the cerebrum, and you have the central sulcus, and you have precentral gyrus and postcentral gyrus. Okay, the corpus callosum. It's a white matter tract of axons that communicate between neurons of the right hemisphere and left hemisphere. And that is the same for the anterior commissure. It's a white matter tract of axons going between the right and left hemisphere. The fornix is a white matter tract which links the different parts of the limbic system. So we'll talk about that. You have the choroid plexus. Let's see, does it have choroid plexus? So this is the thalamus, right? So it's showing you the thalamus, that thalamic nuclei, and then the third ventricle is open, right? So it's kind of opened up because we cut the other thalamic nuclei off. But you have the choroid plexus up here, these ependymal cells. Up on top is like the seahorse mane. And then the man bun back here is the pineal gland, which secretes melatonin. And then, of course, again, this is the thalamus right here. This would be the hypothalamus. And what is off the hypothalamus, in its chin, is the mammillary body, which is reflexes really for eating, licking, chewing, swallowing, sucking. You're born with these reflexes, and these neurons that control the reflexes are here in the mammillary body. Now, from the hypothalamus, the optic nerve comes right by the hypothalamus. And so the optic nerve crosses, right? So there's a cross in the optic nerve here. And so where it crosses is called the optic chiasm. That's the crossing of the optic nerve. And then this becomes cranial nerve 2, or the optic nerve. I should say the optic nerve is coming from the eye and going that way and crossing. So that's the optic chiasm. Now we get to the midbrain, which is the neck, and you have the cerebral aqueduct, or the aqueductive midbrain here. The seahorse, like I said, is going to school, and it's got a little backpack, and there are 4 nuclei. So this is only showing you 2 of the 4 because the other 2 are on the other hemisphere. There are 2 superior colliculi and 2 inferior colliculi, and that's why it's the corporal quadrigemina. The superior colliculi are for vision, visual reflexes. I should say, what do they say? It's visual input, and inferior is for auditory reflex or input. And so again, corporal quadrigemina is on the back of the midbrain. There is a superior and inferior colliculi on the right and one on the left. Then we go down a little bit further, and we have the 4th ventricle. The 4th ventricle is sandwiched between the chest of the seahorse, which is the pons, and I like to call it the coral reef, which is the cerebellum. And then we have the brain stem, the medulla oblongata. And so that kind of goes through all of the parts of this. Okay, so I talked about the fornix. Fornix is a white matter tract that connects the hippocampus with the hypothalamus, and some of its fibers extend to the mammillary body, and also nuclei on the thalamus and hypothalamus, and also reticular formation. Here's the thing, the limbic system is your emotional brain, or your emotional, I don't know, it's not really your emotional brain, but it's your emotional kind of areas. And so we have a lot of emotions tied into chewing, eating. Hippocampus is memory, right? Because our emotions can affect our memory. Hypothalamus controls heart rate, blood pressure, whether we're sweating or not. and whether we want to eat or not, and our alertness, right? So that's the reticular formation. And so the limbic system not only establishes emotional states, but kind of links conscious function with unconscious, autonomic. So if you're really stressed out, your heart rate's going to go up, and your heart rate's going to go up. And if this area also facilitates memory storage and retrieval, that's a problem if you are super stressed out, because that stress is kind of making all of your energy go to the stress, and you can't really retrieve memories at the same time. So that's why they always, the deep breaths and the calming down, it's really trying to kind of control your limbic system so you can use those neurons for memory storage or memory retrieval instead of stressing out, right? It's really hard to concentrate when stressed. So this white matter tract, the fornix, is connecting all these different parts. The diencephalon, again, has the epithalamus, and so the pineal glands on the very back. And this kind of shows you there's one pineal gland and there's two choroid plexes, right? So two choroid plexes. It's showing you the third ventricle is here between the two thalamic nuclei. So this is posterior view, so you get to see the corporal quadrigemina, right? So there's 1, 2, 3, 4. There are two thalamic nuclei. Part of the thalamus is involved, or areas of the thalamus is involved in the limbic system. But it's also, again, a final relay point for ascending sensory information. It also does loop in with the motor going to the premotor cortex and primary motor cortex. So here's the thalamus. It's looking anterior. Here's the third ventricle. Here is the optic chiasm, right? So it's crossing over. And this is the front of the midbrain, and the midbrain has these cerebral peduncles. So this is a cerebral peduncle, and these are white fiber tracts going from your primary motor cortex down to your skeletal muscles. That's what the cerebral peduncles have, a lot of those pyramidal tracts, which are the somatic nervous tracts. You don't need to memorize that. I'm just giving you the FYI on that. These yellow things here are cranial nerves. We'll talk about cranial nerves. But again, the thalamus, relay center for sensory and motor, whether it's coming in or going, final relay point for all ascending sensory information. Also helps coordinate activities that are motor. And then each thalamus has different parts that are associated with all these different things here. So, like this is vision, hear, and auditory, and different association areas and so forth. And you don't need to memorize that, but just pointing that out. Hypothalamus, tiny little area, got a lot going on. In fact, when we talk about metabolic syndrome, why obesity is causing such an issue, and people that are obese are having what are called metabolic syndromes. It even affects their hypothalamus and hormones working on their hypothalamus properly, because your hypothalamus is where you have the behavioral drives to eat and drink, and it starts malfunctioning as well in obese people that have metabolic syndrome. But we'll talk about that a little later. You do have autonomic nervous centers. It's part of your emotional brain or limbic system, right? So your subconscious control not only of muscle contraction, but pain, pleasure, rage, sexual arousal, fear, etc. You also have autonomic centers. That's why your heart rate, blood pressure, respiratory rate, and your digestive system starts getting out of whack when you're super stressed out, right? Where you have a lot of fear, or what we would just call stress. We can have digestive malfunctioning. There's some endocrine that we'll talk about in chapter 19. It does secrete hormones that control not only the hormones of the pituitary, but secrete its own hormones through the pituitary. regulates body temperature and also regulates circadian rhythms, in addition to feeding and thirst and production of emotions. That's why we have a lot of emotions with eating and drinking, and you know, if we don't get enough sleep, it can affect our satiety centers, it can affect our emotional centers, right? Because they're all tied in this tiny little area, the hypothalamus. All right, we still got to get through the mesencephalon or midbrain. We got the corporal quadrigemina. We have the superior colliculi, visual, inferior colliculi, auditory. Then we have some nuclei on both sides. The substantia nigra produces a neurotransmitter that is important in motor output. And this is affected with Parkinson's disease. And so with it produces L-DOPA, which is this neurotransmitter that helps regulate smooth motor output. If you don't have this neurotransmitter being produced, then you don't have smooth motor output, you have tremors. And that's the first sign of Parkinson's. So that's where the substantia nigra stops producing this neurotransmitter. So Parkinson's is kind of a midbrain issue. Red nuclei is also involved in integration between the cerebellum and cerebrum, so motor. And then you have the reticular formation, which is responsible for staying conscious and alert. The cerebral peduncles on the front are ascending fibers that synapse in the thalamus, but descending fibers of the corticospinal tract, that's the pyramidal tract that involves your somatic skeletal muscles, your voluntary skeletal muscles. So this goes through all these, again, with the midbrain, and you can review those. The pons has the cerebellum directly across from it, and you have the fourth ventricle here. What are things? It's really a relay between the cerebellum and going up to the brain. And then you have respiratory centers for respiratory rate and depth, because it is an autonomic function. Those centers are located in the pons. The pneumotactic and apneutic, my mouth isn't working correctly. Anyways, respiratory centers, because I just have been talking too long and you guys have probably stopped listening to this. Maybe you took a break. I probably should take a break, but you have these respiratory centers. And you have ascending and descending tracts. Cerebellum is your motor brain. I kind of feel like it looks like ground turkey. You have two hemispheres really, and a vermis in the middle. And anterior and posterior lobes. Your cerebellum is receiving all proprioceptive information, so about muscle length, tendon tension, joint position. It receives it, and then from the pons it goes up to also be perceived in your cerebrum. But the cerebellum then monitors this proprioception and integrates it with visual and tactile balance and sensation that's getting received in the brain, and then it really coordinates all the different movements and maintains our balance, and also where our eyes track. So really adjusting postural muscles, equilibrium muscle tone, and then also having really complex fine-tuned voluntary and involuntary motor programs that then can get sent to the frontal lobe to go out to your muscles. So it is your motor brain. Last but not least, we have the medulla oblongata. It's really the brainstem that then continues on with the spinal cord. Very basic heart rate and blood pressure and digestive activities, meaning you could be brain dead, everything else is gone except this, and you're still going to have a heart rate and a blood pressure and some digestive activity if food gets put into your stomach. But it's very basic. You also have cardiovascular respiratory centers that control this, and we have cranial nerves 8, 9, 10, 11, and 12 coming off the medulla oblongata. So these cranial nerves I keep talking about are either going to be sensory. Oops, let me do that there. So they're either going to be sensory, motor. So this is motor only, sensory, both. and motor, or just motor, right? Or both, or sensory. You get the idea, right? Cranial nerves can be pure sensory or pure motor or mixed, which is both sensory axons and motor axons. All spinal nerves are mixed. Cranial nerves, on the other hand, can be purely sensory, purely motor, or mixed. And so we're going to go through these. So they're basically Roman numerals from most superior on brain to most inferior on brainstem, right? So they're just going from highest to lowest. And they're paired. So you have one on the right and you have one on the left. So two, just like spinal nerves. So the olfactory nerve is our smell, right? So this is the cribriform plate. These are the olfactory foramina, and these are the receptors. They're up here. And so it's smell. The receptors are embedded in the olfactory epithelium. They pass through the cribriform plate, and you have to actually sniff to bring the chemicals up so you can actually have those chemicals hit the receptors. Optic nerve passes through the optic canal of the sphenoid and then crosses over at the optic chiasm, synapses in the thalamus, and then goes back to the visual cortex. And so again, these are the optic nerves. This is the optic chiasm where it crosses over. By the way, that's the pituitary gland right there. Ocular motor. So these are pure motors. By the way, this is pure sensory, right? It's just all smell coming in, all vision coming in. And this is all motor out, right? So these are controlling eye muscles, and they all go through the superior orbital fissure of the sphenoid, and it's controlling the superior, inferior, and medial rectus muscles and the inferior oblique muscle. Also, your intrinsic eye muscles that control the pupil diameter. So if someone flashes a pen light, a light into your eye to see if your pupil constricts or gets smaller, and then when they pull the light away, it gets bigger again in diameter, they're actually looking at the function of your ocular motor nerve, or cranial nerve 3. Trochlear nerve is also pure motor, and it's going to the superior oblique muscle that controls the eye. And this goes through the superior orbital fissure. You have the trigeminal nerve, and so there's 3. One's going through the superior orbital foramen, the infraorbital foramen, and the mental foramen, right? So it's going through these structures that we got to learn. It's sensory and motor. So sensory coming in, let you know what's going on with the face, but also motor for lips, tongue, part of your tongue. And it has the 3 branches here. Abducens is also motor for eye muscle, right? And so the lateral rectus, moving your eye to the side. Again, superior orbital fissure, that's why it's so big. Facial nerve is sensory and motor, so controls your facial muscles, but also allows you to feel sensations in your skin and face. Also tears, the lacrimal glands and nasal mucosa, and some of the salivary glands as well. Vestibular cochlear nerve is sensory, and so this is balance and equilibrium coming from your vestibular complex, the semicircular canals in the vestibule, and also coming from the cochlea, which is hearing. So this is hearing, and this is balance and equilibrium. And then they join one nerve and become the vestibule, which is the vestibular complex, and the cochlea, which is the hearing. And so that's sensory. Glossopharyngeal goes under the tongue. It's sensory and motor. So the other part of the saliva, which would be the motor, and pharyngeal muscles for swallowing, but also you have some sensory coming in as well for taste. Now, jugular foramen is where it passes through. Vagus nerve, cranial nerve 10, is actually your parasympathetic nerve of the autonomic. So this is your rest and digest nerve, the autonomic nervous system. It's sensory and motor, so you have visceral sensory coming in for your visceral organs, right, to allow you to feel what's going on in your stomach and intestines and so forth, but also then it controls respiratory rate, cardiovascular, digestive organs, and so forth, stomach, muscles, that kind of thing. Then we have, let's see, did we stop sharing? I'm still sharing, I hope. Okay, just checking. I can't see where it's there, but it's there. Yay, okay. The accessory nerve is cranial nerve 11, and this is pure motor to nerves in the neck, again, jugular foramen. And these control really swallowing, sternocleidomastoid and trapezius. And cranial nerve 12 is the hypoglossal nerve, goes through the hypoglossal canal and is motor for tongue movements below the tongue. This chart just goes through cranial reflexes. And these are looking at the different cranial nerves and seeing if they're functioning, right? So pen light, looking at movements, and then auditory. And then you can also have balance and equilibrium. But that is a long one, I know, but the brain is very complex. And so I hope you made it all the way through.